Thank you very much for giving me the opportunity to present the global experience in progress for cervical cancer elimination. And I will start with the global problem of HPV disease. I don't know why. Oh, sorry. Oh, sorry. Okay. Then, as you know, HPV infection causes about 5% of all cancer worldwide. And this is an estimation, but we think that there is a 600,000 women which has the cancer every year. But also men are involved by HPV cancer-related disease, which is about tenfold less important than the woman. Then it's about 60,000 men which are involved by cancer, and we'll see what are those cancer in men in my country. I will present you after that a short presentation of the situation in France. Then we need to improve and to fight against cancer due to HPV. And as you know, those cancer, about 600 new cases, goes to 300,000 deaths every year. Then half of the cancer go to the deaths in women which are very young. And the highest rates of cervical cancer incidence, mortality, are present in low and middle income countries. And as we see here, for example, in the European region, only 60,000 women are newly diagnosed with a cervical cancer, and half of them will die for this preventable disease. This is a situation, for example, in Europe, but as you know, all of you, one woman dies of cervical cancer every 2 minutes in the world, every 2 minutes, which is really a tragedy, as the WHO says in 2018. We know that it's possible to prevent HPV infection. For example, during 10 years, 100 million adolescent girls receive at least one dose of an HPV vaccine, but 95% of those vaccinations are done in high-income countries. Around 30% of low-income countries reporting having pathology service, only 30% have pathology services and cancer surgery or chemotherapy or radiotherapy to take care of those patients. And in high-income country, 90% of these countries has all those structures to take care of patients. And we'll see that all those problems are mainly present in low and middle income countries and less than high income countries, but high income countries may have some other problem. And as you see at the last point, as a last point, less than 25% of low-income countries have introduced an HPV vaccine into their national immunization schedules. If we see here the repartition of country which has an HPV vaccine in national immunization schedules, we see that high-income countries have this vaccination at 85%, but if you're looking at low-income countries, less than 30% have a vaccination program of an access to a vaccine. For the screening is done in high-income country for 80% of women. But in low-income countries, you may see that screening is less than 40% of patients, which is very, very low, and this is a real problem. If we are looking all the structures which are taking care of cervical disease, precancerous lesion or cancerous lesion, we may see that it's a very important problem. The low-income countries have low level of cancer centers, low level of pathology services, less than 40%, cancer surgery less than 30%, chemotherapy less than 30%, and radiotherapy less than 20%. Then we cannot take care of patients at the same way in high, middle, or low-income countries. That's why WHO presents a proposal for 2030 to have 90% of girls vaccinated, 70% of women which are screened by 35 years old, and 90% of women identify as having a disease to be treated properly. But I'm not sure that those proposals could be realistic since the next 7 years, because in low-income countries, there is a very difficult situation. And we are trying with the IFCPC to improve that and to help the WHO proposal. And I will tell you after, at the last slide how we can help the low-income countries. In France, what is the situation? Since the beginning in 1990, since 2015, then we have a decrease, a very important decrease of invasive cervical cancer incidence. But since 10 years, 2015 to 2024, we have a stagnation of the incidence of cervical cancer. We didn't rise a decreasing level of invasive cancer. Why? We have an organized screening program in France since 2018 with a cytology every 3 years, with HPV testing from 30 to 65 years old every 5 years. We begin the screening at 25 until 30 by cytology and 30 to 65 by HPV testing every 5 years. But our coverage of the population is quite low and doesn't move from the level of 60% of the population. We have an access to the vaccination since 2007. Girls from 11 to 14 years old with 2 doses, and to 15 to 19 years old with 3 doses, and boys are vaccinated in France since 2023, then 1 year. But our coverage of vaccination is very, very low, and it's a lower coverage in all Europe. Girls with almost 1 dose, less than 40% of young girls are being vaccinated, and boys less than 10%. 8% of boys has been vaccinated in France. And then, if we are looking at the incidence of invasive cervical cancer in this slide, we may see that globally the incidence is decreasing for young women, but it's increasing slightly for women of 60 years old and women of 50 years old. Then we have a very light increasing incidence in this group of patients because the coverage of screening is decreasing after the age of 50 years old. If we are looking here on the incidence of precancerous lesion, high-grade lesion, we have since 2010 a very light increasing incidence of high-grade lesion, not for young patients, but mainly for patients from 25 to 44 and from 44 to 64. And then the global incidence of precancerous lesion is slightly increasing in France since 10 years. And if we are looking what is the situation now in our country, every year we have about 37,800 cases of precancerous or cancerous lesion for women and around 2,000 cancerous lesions for men. What is the repartition of lesion? What is the lesion? 200 cancer of vagina or vulva, 1,000 cancer of anus in women, only 400 in men, 400 cancer oropharyngeal cancer for women, and 3 times more in men, 1,300, 3,000 invasive cervical cancer, 3,000 of precancerous lesion of the vulva or vagina, and 30,000 precancerous lesion of the cervix, which is around 40,000 lesion, high-grade lesion or invasive lesion due to HPV in women, and about 20-fold less in men. Then it's mainly a problem for women, and the only massive problem for men are oropharyngeal cancer due to HPV. Then the situation in France is a stagnation of invasive cancer incidence, a slight increased incidence of high-grade lesion, and then we have to improve our screening coverage by information, call and recall situation, or auto-testing, but we didn't begin at the moment really to test the auto-test in our country. And we have to improve, of course, vaccination because we have only 4% of young women vaccinated, and it was less than 30% during the last 10 years. Then we have a very low coverage of vaccination, and we are not fighting very well against cervical cancer. And I want to finish my presentation by saying that we are, with the IFCPC, trying to organize prevention, screening, and treatment of cervical cancer to improve that in the Pan-African Congress, joining all the African countries because we know that in Africa, about 50% of all the worldwide cancer are detected in this country. And I want you to invite, of course, to our IFCPC webinar. The first one will be on Wednesday, 13 March. It's about endocervical lesions. And I hope you will be present during our next World Congress of the IFCPC, which will be in Paris in June 2026. Thank you for your invitation, and thank you for having me the opportunity to present the situation worldwide and the situation in France. Thank you, Jacob.